Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Shakil, Salam, and you're watching Ummah channel. This is a special program, Healthy Bite, Ramadan special, and today we're going to discuss about dental care during month of Ramadan, how to look after our teeth in the month of Ramadan. I'm pleased to announce that Dr. Nadim Majid, a dental surgeon, is with me today, and we're going to discuss how to look after our teeth, how to protect our teeth, and how to deal with it in the holy month of Ramadan. Dr. Nadim Majid, welcome to the program. Assalamu alaikum.
Wa alaikum salam. Thank you for having me.
Okay, Jazakallah, thanks for coming. And Dr. Nadim Majid is a local dental surgeon, and he's going to discuss some key aspect of looking after our teeth in this holy month of Ramadan. As you all aware, in month of Ramadan, all our routine has changed. We get up early in the morning, we don't eat throughout the day, and we eat very late. The whole routine of sleeping, getting up in the morning, and going back to work, things have changed dramatically. How important it is to carry on looking after our teeth, brushing our teeth twice a day as recommended by the dentist, and what are the key aspects of making sure that in month of Ramadan what we should be eating and what is good for our dental health. So Nadim, if we talk about in month of Ramadan, as I mentioned, the routine has changed. We get up early in the morning. There's a lot of other priorities. Preparing food, having loads and loads of food. And I think by the time it comes to brush our teeth and looking after our teeth, that might be the bottom of the list. Shall we carry on as normal? And what are the key advice during month of Ramadan?
I mean, it's really important to make sure that you incorporate your sort of general oral hygiene routine within the month of Ramadan, just as you were prior to that as well. And also to make sure that you are able to do that at the right times as well. So for example, after Sahri, before you get ready to close the fast, to make sure that you actually brush your teeth prior to that as well. Because obviously once you've eaten, there will be more than likely sugar in the mouth, which can then potentially damage the teeth as well.
Okay. And as I said, our routine in terms of eating habit changed dramatically.
Yeah, that's right.
We get up at Sahri time and eat probably all the wrong food as well. And especially at Iftari time, we eat plenty of food, and brushing our teeth probably is not the priority. So what is the advice in terms of our eating routine?
Sure. I mean, one of the things that does tend to happen as you go through the month of Ramadan, particularly towards this year where the fasts are very long, it's a long day and also probably quite warm as well. So we're very likely to get dehydrated and lose our energy reserves as well. So what the effect of that is that during Iftari, when you're ready to open the fast, most people do get a craving for sugar and sugary food as well, which is quite natural, particularly if you've not eaten throughout the whole day as well. So what tends to happen is we crave those foods that will give us the high level of energy very, very quickly. And often those are the same foods that are more likely to cause damage to the teeth as well. So it's very important that once you've completed the Iftari, to make sure that you brush your teeth, make sure to get rid of any sort of remnants of food as well.
So the routine is exactly the same, brushing teeth twice a day, Sahri time and Iftari time.
That's right,
2 minutes again?
2 minutes a day. And also if you have any if you're flossing or if you've been recommended by your dentist to use brushes in between the teeth as well, to make sure that you incorporate all that as well. Often it is, like you say, the month of Ramadan, it's not usually something that most people would think is a priority, but it's just as important, if not more so, because of what's happening to the body at that moment during that month as well.
What impact it has on our teeth? Because as I said, in month of fasting, we're not going to, or we don't eat for at least 18 hours
Yeah,
a day.
that's right.
So because we're not going to drink enough water,
Yeah.
we won't have any food. So in a way, our teeth are not going to be affected at all because we're not eating as much as throughout the day.
That's correct. You're not eating throughout the day, but what happens is that because you're not eating throughout the day, most people will tend to eat a lot of food at usually two times during the day, and most of the time it's a lot of high sugary intake and high calorie food towards iftari, which then has an implication on the sugar levels inside the mouth. The other aspect of it is that because we're not drinking water throughout the day as well, we're very likely to get a dry mouth, and the whole body is likely to become dehydrated as well. With the dry mouth, the saliva has a very important role inside the mouth, and that is protects the teeth and also the rest of the mouth as well. So when you're dehydrated, if you're not drinking enough water throughout the day, then you do become dehydrated, which then has an impact as well. So it's also very important to make sure that at iftari you are drinking as much water as possible to rehydrate the body, and also to make sure that you protect the rest of the body as well, not just the mouth as well.
And you mentioned about sugary drink.
Yeah.
And excessive amount of sugary stuff we eat at iftari time. What will be the best advice how to avoid teeth decay and prevention from getting teeth worse? What will be the good
I think obviously with any food it's always a good idea to have it in moderation as well. But like I said, with fasting and with Ramadan, there is a tendency to overeat, particularly at iftari, because you've not eaten throughout the day. And also, it's a time of the day when we tend to concentrate a lot of sugary food. I would say to try and sort of keep that down to a minimum and try to edge towards more natural sugars, things like fruit, and also incorporate enough fiber as well within the diet as well. The effect of that will mean that the sugar won't have as much as an impact as sort of things like sweets, chocolates, that type of food.
Yeah. You're watching a Healthy Bite, a special health program during month of Ramadan. My name is Shakil, Salam, and I have guest Dr. Nadim Majid. He's a dental surgeon, and we're talking about looking after our dental care in the holy month of Ramadan. There are a lot of questions, and one of the specific thing people probably wanted to know, as many other treatment, in month of Ramadan, we try to sort of avoid everything. Even we did a program on diabetes, and a lot of people don't take medication on time and don't go and seek any help and support. In terms of dental care and dental treatment, in month of Ramadan, how important for us to go and seek help and support?
Yeah, I mean, personally, obviously, there is some individual variances depending on who you speak to as far as the religious aspect is concerned. But in terms of the actual, if you do have any sort of dental emergency, you've broken a tooth or you are in any pain, then I would say that would probably be considered a priority by most people, and that's something that you do need to get treated. With regards to actually sort of routine dental care, I would sort of get individual advice from your dentist, but I think in most cases that's something that can be left to after the month of Ramadan if you so wish. With sort of routine examinations and dental checkups, a lot of my patients generally just when they come in, they tell me that they are fasting, and in most cases we can do that without any sort of complications.
Okay, so people can still go to see their dentist during the holy month of Ramadan and get the treatment. Again, if you want specific question relating to your health and well-being, specifically on Islamic point of view, talk to your local imam, and they will give you a religious advice. This program is specifically looking at the medical side of it, and we got a health professional who can give you all the medical advice. Again, it's very generic advice. Individual need to go and consult their own GP and the dentist for further information. Smoking in month of Ramadan, people don't smoke. So that's good news for teeth, isn't it? Because
Yeah, to a certain extent. I mean, obviously the month of Ramadan, a lot of it is about sort of cutting back on things. And if you are a smoker and you stop for the month of Ramadan, then that might be a good incentive to then stop altogether after Ramadan as well. So it's just something to bear in mind as well. I mean, smoking does have an impact on the oral health as well as the general health as well. So that doesn't change if you're not eating at all. It still has the same impact.
Mm-hmm. Okay. One of the common questions is that when you're not eating or drinking anything throughout the day, up to 18 hours, you kind of get a bad breath.
Yeah.
Is there any treatment for that? Any solution? Any tips? For that?
Well, I mean, that's a difficult one because obviously a lot of that is due to the fact that you're dehydrated, really. And throughout the day, like I said, particularly this time of year as well, when it's quite warm as well. If you're out about and working, and with the actual fasting period as well being quite long as well, there's more likely a very high chance that you are going to get dehydrated as well. So more commonly the actual bad breath is due to the actual dehydration because there's not enough sort of saliva inside your mouth as well. However, if you are suffering from sort of bad breath and it's very severe, then I would say that there are a number of other causes and possibilities, and that's something you would need to sort of consider speaking to your dentist about that. Okay. But if it's just sort of bad breath during the month of Ramadan, more than likely it's due to the fact that you're dehydrated.
Okay.
Yeah.
So this is about your dental care, and Dr. Nadim Majid is with me, and we are talking about looking after our teeth, dental care in the holy month of Ramadan. I mean, people get sort of gums disease and probably bleeding as well.
Yeah.
What's the causes of that, and what people need to do that? What is the treatment?
I mean, some of the things that could be happening during the month of Ramadan is that as you go through towards the end of the fasting period, towards the end of the month, there is the sort of some aspects that your body does become a little bit more less immune to infection. So it's just because you're not having enough food to eat as well, you may find that the gums tend to bleed towards the end. In most cases, that's something that can be reversed, and after the month of Ramadan, if you once you start eating again throughout the day, more than likely you'll find that that sort of should stop as well. If you do find that it doesn't and it continues again, it's something to speak to your dentist about that.
Okay. And also in month of Ramadan, as I said, people tend to go to mosque more regularly.
Yeah.
And rather than using the toothbrush, they use miswak. That's as good as it is it?
I mean, I wouldn't. I don't know if there's any sort of studies or anything to show the difference between that. But generally, I would still sort of stick to the brushing twice a day, using toothpaste. At least during after iftari and also at sehri time as well, to make sure that you've cleaned everything as well.
Okay, and also there's technique as well, isn't it? Brushing teeth is fine, but it have to be on a certain way. You need to clean your teeth, and especially in the month of Ramadan when you've eaten sort of excessive amount.
Yeah.
So after sehri, as I said, because we haven't eaten all day, our eating habit will change. What is the best time to brush your teeth? In the morning or in the evening? I
think what I would probably say is that to brush your teeth after you've had something to eat for sehri, before you go, if you are going back to bed, before you go back to bed. And then also after iftari, if you are going to tarawih, before you go to sleep as well. So it's probably more than likely most of those times when just before you're going back to bed. And then also just rinse your mouth out. Make sure that you get rid of any sort of foods, because you're having a lot of high sort of calorie food intake, you know, at one moment in time. Particularly things like, you know, sticky food can stick and leave remnants inside the mouth as well. And obviously you don't want those to be sort of, you know, bits of food falling out inside your mouth throughout the day. So just to make sure that everything's nice and clean, and just spend the same amount of time, you know, 2 minutes brushing, making sure you get everywhere, and then just rinse afterwards to get rid of any sort of food as well. So.
And we're looking at dental treatment. What are the key sort of treatment is required, you know? Why do we get gum disease or infection in our teeth? What is the causes of it?
I mean, gum disease can be caused by a number of reasons, anything from, you know, not brushing properly to then if you've got sort of a lot of systemic diseases, or, you know, diabetes can have an impact on your gums, as well as the general health if it's not well controlled. So there's a number of reasons. If you are suffering from gum disease, if you do find that your gums are bleeding when you're brushing and throughout the day, it's probably something to speak to your dentist about, and they'll be able to best advise you. If it is your sort of oral hygiene isn't as adequate, then they'll probably advise you to brush a little bit more thoroughly, and also get in those areas where you're not sort of brushing. If there is something else underlying which is causing it, then in most cases the dentist can refer you to the correct specialist to get some further information.
And does diet play an important role to have impact on your teeth?
Yeah, it does. Just like anything else. I mean, one of the things with, particularly during the month of Ramadan, is you'll find that there is a small chance that you may find that gums tend to bleed a little bit more. And that's because as you go through the month of Ramadan, you're becoming dehydrated, and then the body's immune system may not be as working as well, because you're not having the same intake of food, so the energy levels are dropping as well. The impact of that is that the body then begins to be less sort of responsive to infection. So the body can then get sort of certain infections, and gum disease is one of those as well.
Okay, and also looking at, you know, we touched on smoking.
Yeah.
But we also, in our community, there is a habit, and perhaps in Ramadan it could be much more prominent, is, you know, with food, having pan and supari and betel nuts and all sorts of things, which we think perhaps is better for our digestive system, and we tend to eat that on regular basis, and most of these things probably tobacco based. Do they have impact on our teeth? Yeah,
well, it's not just the teeth. I mean, particularly with pan and the tobacco based products that people tend to chew, I mean, it's becoming more and more common, one of the biggest causes of oral cancer. I think there was quite a big campaign fairly recently to try and sort of educate people about that. And the thing with it is that people often think that it's actually a health product, which in case it's not. And having tobacco chewing tobacco and putting it inside your mouth for long periods of time, it does carry a very high risk of oral cancer. And one of the very early stages is that you tend to get this sort of discoloration throughout the mouth, and it also discolors the teeth as well. Often we find people will come in with sort of a very dark stain throughout the mouth, staining, and that's just the very early stages of having pan. But yeah, it is it can cause oral cancer as well.
Yeah. And the final question before we go and ask for key tips from you is, it's quite common with some of the people to use a stick to clean your teeth rather than anything else. Is that okay?
Is it the miswak are you talking about?
No, miswak. You know, people use
the toothpicks.
Toothpicks and things like that.
I mean, it depends how you're using them really. Again, if you're using toothpicks, sometimes you can actually do more damage than good really. Particularly if you're poking it into the mouth, you can actually damage the gums as well. So you just have to be careful with that regard. If you are finding that you're having to use something to take out bits of food inside the mouth, it could be that you've got an area of what we call food packing. So it could be a filling or something else that's causing that food to get stuck. So again, it's probably a good idea to speak to your dentist and tell them that, look, I keep getting food packing here. And is there something that I need to use to clean it, or do I need some dental treatment to prevent that food from packing? So it could be a number of reasons why you get that food packing. Personally, I don't recommend toothpicks because, like I said, in most cases, most people will probably do more damage with them.
Okay.
So.
Okay. And finally, to just finish the program, I would like to ask you some key tips for people who are fasting now and they're concerned about the dental treatment. They're worried about the bad breath.
Yeah.
They're worried about pain and infections. What is the best advice?
If you're concerned about sort of having treatment during Ramadan, I would just say that obviously consult your individual religious guide or imam. But if you are in any sort of pain or toothache, then do get that treated and get the advice from the dentist. With regards to the sort of bad breath that sometimes people experience, again, that's usually in most cases due to the lack of water that they're having, because you're not having enough water, the body becomes dehydrated, and one of the early signs of dehydration is that you do get a little bit of a bad breath from the mouth as well. What you've got to make sure is that during Sehri and Iftari that you have enough water to drink, and then also just make sure that you are brushing regularly as well. Just because if you're not eating doesn't mean to say that you not necessarily can cause damage to the teeth. And
finally, the key message is to carry on as normal routine in month of Ramadan.
Yeah.
Brush your teeth at Sehri and Iftari time.
Yeah.
How long do you need to brush your teeth?
I would say on average about between 2 to 3 minutes per time. Obviously, there is some little bit of variance between individuals, but on average 2 to 3 minutes per day.
Any toothpaste is fine, or
I would say as long as you've got a toothpaste that contains a good concentration of fluoride, that's the most important thing.
Okay. With that specific key message from Dr. Nadim Majid, who is the local dental surgeon, he talked to us about looking after our teeth in holy month of Ramadan. Key tips in terms of Sehri and Iftari, what to eat, what to avoid, the sugary food, have plenty of fluid, and as I said, in terms of medical treatment or dental treatment, please go and visit your dentist. They will advise you. And if you're concerned about some religious advice, please go and seek help from your local imam. With that note, can I just say thank you very much for coming along, Nadim Majid. It was really useful. Thank you.
Thank you very much. Thank you for having me.
And that's Dr. Nadim Majid. We're talking about dental care. Hope you'll take advantage of that. If you would like to get more information about looking after your teeth in holy month of Ramadan, there is a lot of information on website. There is NHS Choices have fantastic information, or please get in touch with your local dentist or local doctor surgery. They will point you to the right direction. With that note, can I just say happy Ramadan, look after your health and well-being, and I'll see you in another program. Allah Hafiz.